As in our last video, we have learnt about infection and its types. Now, in this, we will learn about healthcare-associated infection. It is an infection occurring in the patient while receiving care in healthcare facility, which was not present incubated at the time of admission. There are some characteristics of HCAI. Infection occurs 48 hours or more after admission, 3 days after discharge, 30 days after an operation. There are 4 types of HCAI. First, CLABSI, central line-associated bloodstream infections. Second, COUTI, catheter-associated urinary tract infections. Third, VAP, ventilator-associated pneumonia. And last is SSI, surgical site infections. First, we will discuss about COUTI. It is a most common type of HCAIs, approximately 75%. It is associated with urinary catheter, which is a tube inserted into the bladder through urethra to drain urine. Here are some preventive measures. Follow hand hygiene and standard precautions. Use the indwelling urinary catheter only when it is indicated. During insertion, follow aseptic technique. Also, routine catheter care maintenance. Make sure the unobstructed flow of urine is there. Nursing officer or healthcare provider handling patient with indwelling catheter must be trained and enough knowledgeable and experienced. Next, HCAI is SSI, surgical site infection. It is most costly. Preventive measures, divided into 3 categories: preoperative, intraoperative and postoperative. Preoperative. Preoperative bathing is must. Bowel and bladder preparation. Part preparation. Do not use razor. Instead, use clippers. Follow aseptic technique. Intraoperative. Painting of surgical part by surgeon. Use of surgical and properly draping. Antibiotic prophylaxis. Ensure patient body temperature is normal, as low body temperature may cause myocardial ischemia that leads to impaired blood supply, resulting in poor wound healing and SSI. Ensure that blood glucose level should be less than 200 milligrams per deciliter, regardless patient is diabetic or not. Postoperative target blood glucose level is 200 milligrams per deciliter or less. Patient should be normothermic, that is, normal body temperature. Administration of intravenous fluids. Provide nutritional support. Next is VAP ventilator-associated pneumonia, a type of pneumonia where the patient is on mechanical ventilator for more than 2 days on the date of event, with day of ventilator placement being day 1. Preventive measures are hand hygiene, oral care, elevate the head of bed at 30 degrees, suctioning if fluid is present, proper feeding, daily sedation and assessment of readiness to wean. Check for DVT, deep vein thrombosis prophylaxis and stress ulcer prophylaxis. Our last HCAI is CLABSI, central line associated bloodstream infection. It is a primary bloodstream infection that develops in a patient with a central line in place within the 48 hours period before the onset of the bloodstream infection that is not related to infection at another site. Preventive measures are: follow proper insertion practices. Perform hand hygiene before insertion. Adhere to aseptic technique to prevent extraluminal causes. Gauze dressing should be changed every 2 days or when it gets soiled. Avoid femoral site in obese patient. Use maximal sterile barrier dressing. Handle and maintain central lines appropriately. Immediately replace dressings that are wet, soiled or dislodged. This is all about healthcare-associated infection. Thanks for watching.